You're watching KETK's East Texas Living with David Gibson.
Welcome back. Joining us now is Dr. Vasareddy, a neurologist with the UT Health East Texas Neurological Institute who specializes in movement disorders. Thank you so much for being here today.
Good morning, everyone. Thank you. Thank you for having me here.
Yes, so let's start simple. What exactly is a movement disorder?
Movement disorder is a group of diseases that usually deal with too little movement or too much movement. It's actually a pretty young subspecialty that's just coined the term most recently, maybe in 1960s. So we deal with a lot of disorders that involve a lot of movement. So what really happens in these disorders is the smooth signal that comes from the brain is disrupted. So you don't have as much smooth movement like we all do in these patients. So we deal with diseases like Parkinson's disease, Huntington's disease, tics, Tourette's, tremors, all those things are considered movement disorders.
Yes, ma'am. What are some of the common movement disorders people should know about?
I think the most common one that we encounter across the world is essential tremor, followed by, they're not actually that rare. So we see a lot of them like, Parkinson's disease, one of the commonest one that people know about. But we also deal with some rare movements like myoclonus, dystonia, and some neurodegenerative conditions like Huntington's disease, Lewy body dementia, and we treat a lot of emergencies too in the hospitals like myoclonus, and we do a lot of procedures for these too, like deep brain stimulation.
Yes, ma'am. And Parkinson's disease is one we hear about often. Kind of tell us what that is.
Yeah, that's a very good thing to know. So Parkinson's disease is, interestingly, a movement disorder that has too little movement and too much movement at the same time. As you can see, people living with Parkinson's disease have this tremor, which we call as a rest tremor, which means they're sitting quiet and doing nothing and their hand goes tremoring, followed by the most common thing that others don't notice, but as doctors we figure out, is the stiffness. They're pretty stiff in their joints, in their wrists, in their shoulders. And then the most cardinal sign of Parkinson's disease is people getting slower, which means you're very slow to walk, you're very slow to do any movements. So progressively they become slower. So these are the three things that define Parkinson's disease.
Yes, ma'am. If somebody is diagnosed with Parkinson's disease, what can they do to treat this? Yeah,
before we even jump on to treat them, we try to first clarify, is this really Parkinson's disease, or is it one of the sister conditions that's masking, and presenting as different? Like, for example, Lewy body dementia is one of the commonest ones, and multisystem atrophy. So these are some things that can look like Parkinson's. So if we first clarify the diagnosis with various tests, it could be a scan, or it could be a skin biopsy or blood test if needed, but 99% of the times we don't need it. We just go by our clinical exam. And what really happens in Parkinson's disease is this chemical called dopamine is deficient, so we tend to give that out from outside. I want you to think of Parkinson's disease is like diabetes, wherein you have deficiency of insulin and we're giving insulin. Similarly, we have deficiency of dopamine here, so we give dopamine through pills, sometimes pumps, and we also do surgeries for it in advanced stages called deep brain stimulation, so we are producing dopamine in the brain.
Yes, ma'am. Where can people get more information about all this?
You could visit our East Texas website, or you can also look at Movement Disorder Society, which is our society that deals with movement disorders, and that would be a good resource for patients.
Yes, ma'am. Well, thank you so much for coming in and telling us all about it.
Thank you. I appreciate the time.
Yes, ma'am. For more information, go to the website right there on your screen.